Hi everyone, this is my presentation on the Health Leader Evaluation, and I am Ashley Cross. The first healthcare model I'm going to discuss is the National Center for Healthcare Leadership, and the acronym for that is NCHL, which I will be using throughout the rest of this presentation just to save on some time, and a little bit about this. It's a nonprofit organization that uses and promotes evidence based best practices. Now, what I mean by evidence based best practices is that these are processes and plans that have been tested again and again and again, and overall, they're the ones that yield the best results. And these can be used for healthcare leaders, and then they use these practices for their healthcare organizations. They can also be used for organizational development and international healthcare spaces. So it's not just the United States. And the NCHL mission is as follows, and this is a direct quote. Its mission is dedicated to advancing healthcare leadership and organizational excellence by building diverse, inclusive, and collaborative relationships in the U.S. and abroad. And this is just going to go in a little bit more detail about the NCHL and its history. And it was founded in 2001. It was founded by the Robert Wood Johnson Foundation, and it helped in the development of the National Health Leadership Competency Mode. And by 2007, competency based education had become an established part of the accreditation process and was expanded further in the 2013 revision of the accrediting guidelines. And what this means is they really helped build the foundation that a lot of healthcare leaders and healthcare organizations, not only in the US, but across the globe, use today. And it supports its members through collaboration, education, and research. Now I'm going to go into a little more detail on the NCHL and how they go ahead and do their evaluations. And the first part is strategy, and this really is going to cover strategic planning. And strategic planning at its core, basically the basic definition, is asking the question, is the organization fulfilling its mission or vision statement? And every healthcare organization or model usually has a vision or mission statement. And I did mention that earlier in the video. And objectively, though, there's more to it than just asking the question, are they fulfilling their vision or mission statement? And a healthcare organization goes about by doing this by starting out with a plan and really breaking it down step by step and then evaluating each task and assigning each task its goal. So, an example of this would be say you have one problem for a healthcare organization, such as patient wait times. There's going to be more than one reason for this problem. And you're going to have to figure out all the reasons, and then each reason is going to need kind of like its own little mini plan, and it's going to come all together to help solve a bigger problem. And another part is leadership competencies. Now, as I did mention earlier, too, they really do support their leaders, and they do this by delegation, decision making, and problem solving, and emotional intelligence, which are all valuable skills for a leader to have. And in my opinion, emotional intelligence is one of the best leadership skills to have when working in a healthcare organization, just because it's a very emotionally charged field and a lot of things can happen. So, someone that's going to be able to handle the ups and downs that can happen, just say in a normal 12-hour healthcare shift in a hospital setting, is really going to be able to be a good leader. And then they also support leadership development. And they do this by ensuring that the leaders have the proper education. They make sure they have experience on the job. They also support them by providing coaching and evaluation for improvement. And then the last one we have here is outcomes. and outcomes are going to have to be measured, and there's going to be different ways to measure these. And the overall way that we measure outcomes is called benchmarking. And benchmarking is a critical tool for leaders to understand and embrace as a method of tracking programs and performance in the healthcare organization. And benchmarking is a continuous process, and it's not just going to be a one time thing, because in order for a healthcare organization to be successful and in order to know if the strategy was successful, they have to keep checking back. And all that information on the previous slide was provided by the book, and I have the reference right here. And the next one I'm going to get into is the National Public Health Institute. And the abbreviation for this is NPHI, and I'm going to use this abbreviation throughout the rest of the video. And the NPHI is not just one organization, it's multiple, and they are science based governmental organizations that serve as a focal point for a country's public health efforts, as well as a critical component of global disease prevention and response systems. And some well known NPHIs that you've probably heard of are the Centers for Disease Control and Prevention of the United States, or the CDC, and also the Chinese Center for Disease Control and Prevention for China. And now I'm going to go into a little bit more information on the NPHISs and how they function. So they provide surveillance for injuries and diseases, and also surveillance for risk factors such as epidemiological investigations of health problems. And an example of this is COVID-19. They also provide surveillance for public health research, which an example of this is them providing COVID-19 tracing, and also response to public health emergencies. And an example of this would be the COVID-19 quarantine guidelines. And now I'm going to go over the NPIH and their model of leadership. And they support individual leader development, and they do this by giving their leaders a greater understanding of skills and valuing certain approaches in public health and leadership. And this model is a little different in that a lot of the things that these leaders do are going to be in the public eye and under a lot of scrutiny. For example, some of the people that were leading during COVID-19, if things didn't pan out the right way, they were put in the public view and open up to a lot of scrutiny. So they really do focus a lot on providing resources for their leaders. And they also really look out for the leaders' actions. And they do this by um, promoting the leaders to take on voluntary leadership roles. They learn leadership actions and do them every day on the job. They also help develop others, and they're really focused on actions to achieve specific goals. And then it also goes a little more into public health systems and infrastructure development. And what I mean by this is they support policy change and development, system change and development, organizational change, and program change. And again, this leadership model is a little more complicated because it's kind of, in a way, unpredictable. So they do have a lot of many different case scenarios for, what ifs. But again, for example, like COVID-19, there's really no way that they know what's going to happen. And a lot of it is kind of, day to day, especially like for the policy change and development, they will have to wait on, like, I'm going to provide an example. Wait on a certain number of COVID-19 cases before, they could decide, well, does this county need to be quarantined or do they need a mask mandate? So, again, a lot of these are situational and will depend on what the issue is. And there is network development, and they provided it obviously a national level and also at organizational, local, and state level. And again, for the network actions, they can be provided at national, organizational, local, and state. And again, this will depend, it could be, say, a small town, could be different from another small town located close by it. It's just going to depend on each individual situation. And now I'm going to be explaining what model seems most appropriate and why. And I'm going to have to go ahead and go with the NCHL model. And the reason I picked this is because I just feel like it's more applicable to everyday normal healthcare organizations. And they do provide their leaders a lot of support by providing leadership competency skills, training, and they even have an award ceremony yearly that they hold that recognizes those who have excelled in healthcare roles in a leadership position. And I also really just like the all the metrics that they have and the evaluation tactics that they use, especially the benchmarking, because when you're in a healthcare organization, it is difficult to tell, if something is successful or not. For example, say that you work in like retail or in a sales position, and it's pretty easy to tell if a product is successful by, just calculating the sales, but it's very hard to tell, and there's a lot that goes into telling if a healthcare organization is successful. And for example, say a healthcare product. For an example, I'm going to use a hospital setting, a healthcare surgery. And there's so many different ways to tell if this is successful. One would be what's the completion rate? What is the rate of patients who are getting hospital-acquired infections from the surgery? What is the mortality rate? How many people, medical professionals, have to complete the surgery? How much does it cost? There's just so many different factors, and with the NCHL, they really cover, um, almost every single benchmark you can hit when measuring healthcare outcomes. And this is my reference slide. I have all of them listed, and again, I have reference number 1, and that is what I used for my information that I got from my voiceovers. And the last reference is Pixel, which is just a free image sharing website that I use to get my pictures from. And that concludes my presentation. Thank you for listening.